Welcome, guys. Thank you very much for joining us this evening for another Pareto webinar. I am Camille. You might know me from before. You might be meeting for the first time. We've got a couple of other guest presenters and my co-host Mo as well, who's on the chat. You might see him waving shortly for you guys. And there's a couple of other people that are helping us out this evening, and we'll introduce you to them shortly. So this session today is mainly focused on the PA national exams, which we're very sure some of you are nervous about, and we wanted to put together a free session for all the physician associate students who are going to be sitting that this coming summer/autumn. We thought, there's a couple of questions that we might have that we might be able to shed some light on, some last minute nerves, that kind of thing that we might be able to quell. And that's really the basis of this webinar as well. So thank you all for joining us, and thank you for your little bit of patience just beforehand while we just sorted. So like Mohammed was saying, I think the chat function is not working the best. We'll try and moderate he will try and moderate that if it works for some people. And if you do have any questions throughout, there'll be plenty of opportunities where I'll stop. We'll try to group some questions together and we'll let our facilitators sort of guide us through them. Okay, so like I say, there's more on the chat in the screen as well, in the bottom corner waving at you. He's a medical doctor and also a lecturer in physician associate studies, and he's also a founding co-member of our little enterprise. And I'm Camille. I'm also a physician associate by background. We've got a couple of recent passing graduates. So
sorry, Camille, can I interrupt?
Yeah.
I can't see your slides at the moment. I'm not sure if anyone else. Is everyone able to see Camille's slides?
Yeah, we can see them.
Oh, you can see them. Okay, maybe it's just me then. Is that the case for everyone? Is everyone able to see Camille's slides?
Yeah.
All right. Maybe it's just me, but carry on.
So we've got a couple of recent passing graduates. Firstly, I'll introduce Mark to you guys. You probably can see him as well. Can you pass it over to Mark, the little screen? Can you do that, Mo?
Yeah.
Where he can sort of introduce himself a little bit.
Yeah.
Yeah. So I'm a Birmingham graduate. I worked in acute medicine for 4 years, and I now work at the Royal Infirmary of Edinburgh in acute medicine still. I sat the national exam, I think it was April, feels like a lot longer ago, and passed. So happy to take any questions at the end. And
brilliant, yeah. So Mark, that was actually the recertification, was it? The SBA recertification, yeah. Yeah, so obviously he's got experience using the new technology, the software, etc. Big change, obviously, compared to how you sat it previously. Yeah. And obviously Mark's on hand to answer questions in terms of revision, practicalities, etc., etc. So thank you very much, Mark, for sparing some of your valuable time. We appreciate that. And we've also got Aksa in the chat as well, in the call as well. So she's going to be turning on her mic, hopefully now, and she can introduce herself.
So hi guys, my name's Aksa and I sat my nationals in May. Yes, I think it was May. So I went to the University of Bolton and I'm currently working in a general practice in Manchester. So yeah, I'll be here to answer any questions you guys might have about the OSCEs and just generally the nationals. So I think they're coming up in September. So yeah.
Yep, thank you very much, guys. We did have a third guest as well, but unfortunately they had to be called away at the last minute, so not able to join on the calls. But we've got Mark and we've got Aksa, both brilliant, and they can hopefully provide a lot of insight into our discussions today. Thank you. So before we get started, just sort of show a little trailer on the sort of things we've been getting up to in the sort of last year or so. Yeah, so not only are we in the education space, we're expanding to, facilitate, exams, webinars. We're shortly going to be launching a podcast newsletter. So we're doing a lot of things in the medical education sphere. So keep your eyes peeled for any further developments in our follows on social media, etc. All right. So let's get to the bulk of the topic today. So the agenda really will be splitting between the SBA, the single best answer exam, and also the OSCE. So you're all aware that for to be a qualified, fully qualified physician associate, you need to be passing both elements set by the Faculty of Physician Associates. So we'll split the session between the SBA, and hopefully you can ask your bulk of questions about the SBA in that session, and then the OSCE exam, and then you can ask the bulk of your questions on that. So I know Mark and AXA was saying about their background. I'm also a physician associate by trade as well, graduated from the University of Leeds 2-3 years ago now. So I can also give some input into mine, and also I've also been an examiner as well. So the kind of things that examiners like to ask and kind of stations that would potentially be coming up as well. Okay. So the SBA exam, you're all aware of. You should have received your login details, etc., to that exam. Either already or very shortly, and that's a single day where everyone sits that exam around the country. So that's on Thursday, 8th of September, coming up very, very shortly. And it's it's an SBA component with 200 single best answers, and it's delivered online via Ozone. These should not be new things for you all to hear. And you need to install that software and be registered to be active. And also be eligible to sit the exam. And the results, like I say, will be available on the 3rd of November. Now, this is, I think, a prime opportunity to slowly start asking your questions. But before we do that, we'll just sort of talk you through the little splitting of questions and where best to sort of direct your revision. If you're at that stage where you're really doing that last minute revision, couple of weeks left for the SBA exam, and you want to see where shall I target my revision? What's going to give me the best bang for my buck in terms of my revision now. So as you can see, we've broken it down, the exam paper, based on the Faculty of Physician Associates. Now, this information is freely available on their website, and it gives you sort of breakdown in terms of how they will weight each sort of subspecialty in medicine. So as you can see, there are some subspecialties which are very heavily weighted, and they will ask a lot of questions about that. So at this stage in your revision, you should be focusing more towards the larger subspecialties, for example, cardiovascular medicine, pulmonary or respiratory medicine, kind of things, to give you the more chance of scoring higher marks. Obviously, if you focus on these, you're more likely to, pick up some marks from these bigger sections, which will come up again and again. But, if at this stage you're perhaps struggling with hematology, I wouldn't put a big focus on that, because that's only responsible for a very small subsection of marks available. And that was my strategy when I sat my exams, and it worked well for me. It might not work for you, but that's the kind of advice I would give for you at this stage of your revision. If you've gone through the 2 years and you're thinking now, at this stage, where do I want to focus my revision? These are the kind of things that you want to focus your revision on. All right. Any questions from this slide? Does anyone have any questions for myself or anyone? No? All right. So I thought, I'd start the conversation flowing by a couple of questions from ourselves, and we can ask them to Mark, and we can ask them to AXA as well. And they'll sort of, give a basis, a sort of baseline, then we can ask more specific questions from that. So if I start from AXA, the SBA exam, from your preparation and compared to like university exams, how difficult was that exam for yourself? Was it a surprise? Was it, about the level you expected?
No, I think it was what I expected, and I actually found my university exam harder.
Right.
Than I found the SBA exam. I'd say because there's 2 papers that you have to sit. So the first one I found it easier than the second one, and my friends also found it same way. So I think one paper they do try to make a little harder. you know, but in terms of my revision, it was just pass med and plabable for PA. And I feel like they really prepared me. Timing is probably your biggest issue. So you need to be practicing as many questions as you can, so that you don't run out of time. You know? So it wasn't too bad, as long as you make sure you practice the questions in timed conditions.
Anyone got any questions on the back of that?
It's a free
Come on,
for all,
guys,
guys.
it's your
So please,
chance. Yeah.
ask your questions.
Yeah.
I think there's a hand up from Petra.
Yep.
Yeah, hello, can you hear me?
Yeah, of course.
Yeah. Please, can I ask, on the past medicine, there is, I think, a lot of subsection. Which exactly have you used for your revision? Or it really doesn't matter? Or do you have any specific you could recommend, please?
I mean, the anatomy and physiology isn't really relevant, but I did just use the final year medical student one. I think it's years 3 to 5.
Yeah.
But yeah, past med isn't as relevant as plabable for PA is, but it still prepares you for the kind of questions that you will get. I'd say past med is a little harder than the actual the exam, the SBA exam, but then it prepares you well, and you'd rather be over prepared than under, if that makes sense.
Yeah, sometimes I feel that some of the question banks kind of feel a bit overwhelming, especially if they're geared towards medicine, as in like the MBBS or MBCHB course. You know, if you find something that's relevant to physician associates, you know, go on what your friends are saying, you know, what the university mock exams are saying, that kind of thing. That will give you more of a baseline about what kind of exam questions there are. Now, Aksa, can I just ask as well, was it just, you know, best of 4, or was there extended matching questions, etc.?
Right, so this was a while back, so no, I'm sure there was a mixture. Was there?
Mark,
feel free to jump in, Mark, as well.
Yeah, go on, Mark, because I'm a bit confused now. I'm sure it was majority SBAs. I don't think there was.
As in what? Best out of 4, yeah?
Yes, best out of 4 or 5.
Okay.
Yeah, it was best 4 out of 5. There's no matching or anything. It's just single best answer. Yeah, multiple choice questions.
And so you mentioned, you know, a few resources there, Aksa. What was your best revision tool, Mark? If you put some insight, obviously you'd been away from exams for a little while. What was the best tool that you used?
So when I was a student, we used BMJ on examination, similar to what Aksa did. It focused on the 5th year medical student. In terms of how difficult the exam was, I would definitely say, well, it was an aim for Birmingham to make our university exams more difficult than the national, so that we were well prepared. And at least if we were passing the university exams, we had a good shot at passing the national exam. When I sat the recertification exam this year, I purely used the Matrix app. I use that for my revision, and I use that for questions and my 6 years experience.
Yeah. And did any of you guys use any of the Pareto services, if that's a plug right there?
Yes, I did. So I attended the OSCE masterclass, and I was going to mention this before, but it really did help me in the OSCEs. I don't want to give too much away, but some of the stations that I had in the nationals, I also got to practice in the OSCE masterclass run by Pareto, and I just think it's all about developing that confidence, and the masterclass really did it for me. So
hold on to that thought. We'll get to that shortly in the OSCE bit. So if you mentioned anything else that you used.
No, I for the university exams, I just used BMJ on examination, and research, I just used the Matrix. I just brushed up on things because obviously I work in acute medicine, so whilst I do see some dermatology, there was a heavy focus on GP in the national. So, you know, your common dermatological conditions, I had to look over those. Your
ENT,
common reproductive and all that kind of stuff. You know, the advice on contraceptives is not all that familiar to me anymore, so I had to look at that stuff again. As revision, the research, I was kind of, I guess, similar to what you did when you found yourself weak in some areas. You focus on the areas that you're weakest and go and revise those, but not focusing on ones that, there's only 1% or 2% of the exam.
Yeah, absolutely. So you've got to be very smart at this stage. Yeah.
Can I ask a question,
Mark,
if that's all right?
Yeah, go ahead.
Oh, sorry to jump in. And Axa and Mark, did you find that the focus of the written exam was on a particular theme? So was it more kind of diagnosis heavy or investigations heavy? Like where would it be fair to split the exam like that, as in to try and guide the revision of some of our attendees?
I found a mix, to be honest, of things. I remember when I took the exam 6 years ago, I remember quite a bit of, as per NICE guidelines, what would be the next thing to do, but I don't remember any of that in the one that I did just recently.
Yeah, I agree with Mark. I'd also like to put out there that there's a lot of emphasis on first line and second line management. I found the questions where if you're kind of matching symptoms to a condition, they're kind of the easy ones. And treatments, they can be a little bit tricky because it might just be, I don't know, one word difference in the answers. But yeah, I'd say the focus should be definitely on diagnosis and management. And that's what they're trying to get at. Yeah.
So Axa, yeah, very good question. Anyone else got a question, in regards to, revision and that kind of thing, what the exam content will be?
Can I ask a question, please?
Of course.
It's not on the content necessarily, but with it being online, I was person. With it being online, can you still go back and look over all the questions that you've done or not?
Yes, you can.
Can, yeah.
Thank you.
So I think, based on, you have 2 papers, as per my understanding, and as long as you're within the time limit of that one paper, you can go backwards and forwards. Is that correct?
Yeah.
Yeah. So obviously that should. And is there like a tool where you can flag a certain question and come back to it?
Yeah, I'm sure there was.
I feel like there was, yeah.
Yeah.
But I think you see, if you haven't answered a question, you can easily review at the end and see which ones you haven't answered to quickly go back and see.
Yeah. Okay. So that comes.
There's 2 more questions.
Yeah.
There's one from Miss Kate Brooks.
Hiya. I was just wondering if we're able to have like a piece of paper in the examination, like in the exam, where we could like jot things down, or whether they'll be like, "Oh, you're cheating."
Yeah, you can, but you have to be very careful because you're being monitored. So any sort of head movement that you're doing, that the camera or whoever's watching you seems to think, oh, that there might be notes or I don't know, something like that. If they detect any sort of rapid head movements, you will get a message on the screen. But you are allowed to have paper and jot down notes, because that's what I did.
Okay, fab.
Just don't look around too much.
It's really nerve-wracking, isn't it? That sort of like spy software bit is the bit that's sort of getting me more nervous than just sitting the exam itself.
Yeah.
But like having a drink of water and things like that, what does the flagging, if they message you, kind of mean? Do you get like three and then you're out kind of thing?
No, it's not like that. I think it's just more of like, if they feel like you're turning your head slightly, well, not slightly, but like at an angle, they will just tell you just to face the screen, and you are allowed to drink water. Just make sure that you have removed, I don't know, there wasn't a rule for that, but usually in exams you're not allowed to have plastic on bottles.
Clear water bottles.
Yeah, clear. And when you are drinking the water, just kind of do it in front of the screen so that they know what you're doing.
Okay, fabulous. Yeah. Thank you.
Welcome.
Yeah, I mean, I notes in the exam. I didn't have anything else on the desk, and you have to show them at the end what you've jotted down. I don't know whether to take screenshots or something, but you just hold up the pieces of paper and then you're supposed to destroy them afterwards.
Yeah.
And another question from, no problems, Kate, from Hannah Gilbert.
Hi, yeah, just wondering, so there's 2 papers. Is there a difference in between the content of the 2 papers, or are they just a mixture of questions over both?
there shouldn't be a difference. It should just be random questions throughout. There shouldn't be any themes. Every question is independent of another. I know AXA said that they should call it paper 1 was easier than paper 2, but that's, I suspect, coincidental. But
Yeah, most likely.
Okay, fab.
Yeah.
Thank you.
And we'll move on to final question from Emma Jackson.
This is probably a bit of a silly question, but for every exam so far, I've worn earplugs just to sort of shut out all the noise. And do you think they'll let me wear earplugs in the exam?
Yeah, you can, so long as you show them what is in your ears. You can email the team beforehand. I don't know whether you've got your emails yet to download the software, and you can beforehand and say, this is what I'm going to have. Can you just give me some guidance? And they'll tell you beforehand. Log in early and get yourself sorted on the platform. And there's like an adjudicator there that you can message as well. You can go to the toilet, for example, but you just have to sort of get permission first and clear it with them first.
Okay, that's really helpful. Thank you. I didn't realise there was all of that, because I suppose the other thing that is worrying a lot of us is, what if your internet goes down, or because of best will in the world, these things happen, don't they?
Of course.
If your internet goes, software keeps running, and you carry on with the exam. If it's down for the rest of the exam, then it's saved sort of internally, and when it reconnects, it'll submit your exam.
And there's another question from the chat about the location. Does it need to be a private location? Can it be, as an example, university computer, but in a private room? Is there any stipulation on the type of location? I guess that's the question.
There should be minimal distractions, with a clear room, clear background, nothing too. Obviously, it's using facial recognition to see where you're looking. So if there's lots of things in the background, the facial recognition doesn't work so well. And just have nothing on the desk. Ideally, you should be in a private space. I wouldn't be doing it for your own distraction and things as well. And if there's people walking around behind, that's not really exam conditions. So yeah, it would need to be somewhere private.
We'll just take 1 or 2 more questions, and then I think we should plod on. So we've got another question from Zainab.
Hi, I just wanted to ask, is it 100 questions in each exam, and how long is each exam?
It is 100 questions, because it's 200 SBAs, so 100 in each paper. I can't remember how many. Is it for one question? How long do you get? Is it 1.5 minutes?
I can't remember, to be honest.
Yeah,
the exact time. You'll easily be able to find that on the website. I don't know whether Camille, you have a slide of how long you have in the exam, but yeah, it's 200 questions, and the exam standard, and it's just split between the 2 papers. You have a little break between one paper and the next.
Awesome, and I think that's it for the questions that I can see. Yeah.
I'm so sorry, I have one more.
Go on.
Do we all start at the same time? Is there I'm guessing we'll be told a time, but do we all start at the same time? How does that bit work?
I think once you log in and you're all set, there might be a slight discrepancy of when people start, but generally you're supposed to log in 15 minutes before, and the exam becomes available. You'll just see sort of a box that it's being prepared. I suspect you'll start at almost the same time.
Yeah, because it's timed, it goes off anyway, doesn't it?
Yeah,
so
right,
there might be a little discrepancy, but everybody's getting the same amount of time.
Thank you.
And that's it for questions so far.
Okay,
there is one more.
All right.
We'll make this our last question for this section. Shireen Hassan.
It was just something that AXA said. She said that you get 1.5 minutes for each question. So I was just wondering, like, if the whole exam, for example, is like 3 hours, do you get a solid 3 hours, or do you get timed for each question, if that makes sense?
No,
it's not.
no. So it's not. It depends on you yourself. So how long you take on each question. It's not like, oh, your timer starts for each question, you get 1.5. And I'm not too sure if it is 1.5, but it's kind of how you manage your time. Hence why I said, Shireen, in the beginning that it's really important you practice in time conditions because you could quite easily run out of time. Yeah. But no, it's not like one question and your timer starts for 1.5 minutes.
Thank you.
You're welcome.
I'm pretty sure it's 2 hours you get per paper.
Is it two?
I think so. I think it's 2 hours for 100 questions.
Yeah, I'm pretty sure it's 2 hours for 100 questions. Yeah.
Then it's definitely yeah. Then it's not 1.5. It's way less than that.
Yeah, it's around 1 minute, 10, 15 seconds around that.
Okay.
Yeah. All right. So if I were to ask, in terms of still on the topic of the single best answer exam, how did you structure your revision at this sort of period? 2 weeks out, are you going crazy? Are you giving yourself a break? What's the best way to focus yourself now and in the days leading up to the exam? Do you go more, revise harder, revise how many hours, and even the day before the exam? How do you if I ask Mark that question first of all?
Like I said, I mainly focused using the Matrix app. I know that's probably advertising for another another thing that you don't want. That's what I used. I found it useful to give me a good summary of the kind of history that you would take, and it was kind of a very clinical approach to a case, which more often than not I found like lots of the questions were, okay, you've got this person comes in with this and this is in the history, this is in the examination, this is the OBS. What's the most likely management that you would do? So you can kind of work out what's going on and come up with a differential diagnosis, at least from what's going on. And then you're going into that part of your brain of, well, what's the management for this? So yeah, that's essentially what I did. Try and pull out the weak points using the matrix of conditions and which ones was I unfamiliar with.
And how many hours were you sort of revising roughly? Were you doing a lot? Were you doing a little bit? I mean, obviously it's different because you were in practice, weren't you? So it's a bit different from yourself, but in terms of revision in general.
Thinking back to when I was a student, I'm generally someone who does a lot of cramming. So I was doing, easily 6-7 hours a day at this point, with breaks, of course, but I was just trying to get through as much of the BMJ on examination as I could. In this time, I'm sort of more slower paced and doing revision and then answering questions based on that and trying to solidify my knowledge.
Yeah, I mean, I think I don't want to scare anyone, but you do need to be sort of focused on revision at this period of time, focusing a lot, a majority of your day, trying to get them extra marks because they all make a difference. You don't want to get to this stage and, fall short even by a couple of marks. It's quite disheartening, when everyone else is going through and, you haven't quite reached that mark. So I think I would agree that, you need to give a good solid couple of hours every day, especially at this stage. What about you, Aksa? How many hours were you sort of devoting at this stage?
So the exam is on the 9th of September. So we're not that far off, are we? I'll be honest, because I'd spread my revision throughout the 2 years. Like from day one, I was studying. So I'm not the type of person to kind of cram because I have to be doing like a couple of hours a day. So I'll be honest, close to exam time, like let's say 2 to 3 weeks before, I wasn't doing 7-8 hours. I'm not gonna lie. I was probably doing about 3 to 4 hours, but I was focused in that time, and I was focusing more on things that like I was getting wrong on past med or plabable. I'd go over them kind of topics. And like you mentioned, Camille, like there's no point. For example, if you don't feel hematology is really your strong point, you're not gonna learn the hematology aspect of it in 2 weeks. You're just putting more pressure on yourself. So I think it's more I was focusing on cardio, rest, GI because I knew that they were the big components. So yeah, I was just kind of solidifying my knowledge in the last 2 to 3 weeks. I wasn't trying to learn anything too new because I didn't want to put too much pressure on myself. But yeah, I think I don't know, everybody's different, and it just depends on how well how prepared you feel.
Yeah, of course.
So yeah.
Thanks for that. So just on the back of that last really big thing. So any top tips on the day? I mean, did you go to sleep early, breakfast, this kind of stuff,
Yeah.
computer setting, privacy breaks? Did you tell your family that you have an exam? Like, how did you, for the day, like, what was your setup, Aksa?
I made a really big mistake because sleeping the night before was fine, I had a good night's sleep, but in the morning, throughout the day, I was just drinking so much water, and that's not good on your bladder. So please don't, because when we're nervous, I feel like you want to drink more water, but don't overload yourself, because then you'll need to go to the toilet, then it affects your concentration. So that's what happened to me in the second paper. So yeah, take it easy on the water. But yeah, it is important to stay hydrated as well. Make sure, because I did the exam in my bedroom, so I was quite comfortable. Make sure you're in a kind of environment where it's not a new environment. You have studied there before, and you've told your family that I've got an exam. It's probably one of the most important exams of my life. So no distractions, and make sure you keep the noise down. So yeah.
Yeah, I got a good night's sleep, got a good 8 hours, had breakfast. I just had water on the desk. I live alone, so distractions was no option, but I do have a window right next to me and cars going by, so I had earplugs in. Just remembered that I did have earplugs and it wasn't any problem for the invigilators. And yeah, just be confident.
Brilliant. Thanks very much. Does anyone have any sort of questions on the SBA from this? Any broader questions, but specifically about the SBA, the online exam for our brilliant facilitators for now? You can either put in the chat or you can, put your hand up anyway.
I think Kate Brooks.
Sorry, me again. I was just wondering what like computers and things you used. I saw you shouldn't really use an external camera, but that's all I've got because my laptop's sort of out of the date range that they'd like. So those are just kind of the like bits and pieces I'm a bit unsure of.
If you've been asked to download the software, have you been asked to download the software yet?
Not just yet. Okay.
Well, when you get the link to download it, you can install it. I don't remember seeing if it's not recommended to use a desk webcam. If that's your only option, that's your only option, and it works just the same. It's just, I guess,
I'm on the FBA website now, and it says external webcams are not recommended, but can be used if absolutely necessary. Need a computer or laptop running Windows 10 or later, or Mac iOS 10.13 or later. So I think they're the sort of technical requirements you can find on the website quite easily if you go on FPA website and go on the examination side, and then you can find all these sort of requirements, on there. And if you've got any VPN, you have to disconnect that and all this kind of stuff.
Yeah, that's. I was just wondering what you guys used. Like, I'm not sure what you've got, like if you're on your phone or whatever, but like what you guys used to do it, sort of thing, like computer-wise, because it's just freaking me out.
Laptop, it's got a webcam where they normally are, and I'm running Windows 10. So I got the software a good week or so before, so you can get time to install it and have a look at everything, make sure everything's working.
Okay, thank you. I think we get it in on the 26th, so coming soon.
Not far.
Anything else?
So there's a few more. Shireen, I'm not sure if this is a new question or is this your hand up from the old question?
Sorry, I think that was from the old question.
Fine, hand down then, I guess. So Krishna, would you?
Hiya. Sorry if this is a question that's already been repeated, but in terms of the camera, your background, if it's not white, does that matter? Can it be one block color? But obviously no posters or anything behind.
Yeah, I'm sure that would be fine.
Yeah, I think it's mainly due to the artificial intelligence, the software they use for like facial tracking. So if it's very busy, the background in terms of you've got pictures of your family, you've got other like posters, that kind of thing, that can distract the software and make it difficult for it to focus on your face. So as long as it's like sort of one color, like plain, I think it should be fine.
Awesome. Florence Wright.
Sorry, can you hear me?
Yeah, loud and clear.
Hi. Just a silly question is, if you need to go to the toilet, how do you go about that? Like, do you put a message, or what do you do for that?
Maybe AXA, if you had a full bladder for the majority of your exam, you might be able.
Well, I actually had to, I can't remember what I did, but I just rushed the exam, the second paper, which please don't do it, guys. And I just had to rush to the bathroom. So I don't know whether, I think you might have to put a request in. But I just ended my exam and I had to go.
Yeah,
Okay.
we wouldn't recommend that really. I
But
think
don't
if you
do
need to go
that.
to,
Yeah.
just because in between the two exams you have a nice break, so utilize that break. Have a light lunch, something light, nothing too heavy. Utilize the toilet at that time, and if there is anything that you desperately do need to go to the toilet, I'm sure there's like a request button where you can speak to them, and they will allow you that comfort break, okay, to go to the toilet. But obviously that's not added on to your, so how long you spend in the toilet is entirely up to you, but you're cutting away from your actual exam time, okay?
Yeah. Okay, thank you.
Just a few more questions, not too many. There's quite a few questions about what is the pass mark. Can anyone answer that question?
For me, it was 60%. But it just depends on how difficult the exam is and how well everyone does on the day. But for me, it's 60%. How about you, Mark?
I guess we sat the same exam. Maybe I was just getting my timings wrong. I mean, I sat it this year about Easter kind of time, just after Easter. So I guess we sat the same exam. That sounds about right. But they do hang off the exam. If you know what that means, it's basically they compare all the questions. They see, is a question, has everyone got it wrong? Was it too hard? Do they need to remove that question? Was an answer wrong? That's why it takes them quite a while to get your marks out, because they go through and they see how people have done in the exam. And it needs to, like every exam, it needs to fit a normal distribution. So, they have to just have a look at everything, and the pass mark will change depending on that.
Yeah, I remember from my exam a few years ago, it was around 58%. So I think it's around 60, 60-ish, 62, 63, 60. I think it's around that.
It has been 55 at one point for one of my friends. So it has been as low as 55. I'm not sure if it's been any lower than that though. So
that might have been a tough year. So
yeah.
All right. Well, thank you for all your questions. For this, you can still contact us if you have any specific questions about the SPA. You can always contact us. You can reach us via email, these kind of things. But I think time's getting on a bit, so we'll go on to the next section of the exam. But before we do that, we'll just like to highlight one thing. We do still have spaces available on our early bird written masterclass session. So that's the full day on the 3rd of September, which I believe is a Saturday, just before your examination. And we'll be running, me and Mo will be running a full day covering the most commonly covered topics. The big subspecialties. We'll be giving you just that confidence boost just before the examination. So we'll be covering things like commonly topics that come up again and again, the kind of questions that they like to formulate, see how your revision's getting on, and give you that sort of last minute, just 4 or 5 days before the exam, give you that last minute boost, give some tips, tricks, how to conquer, if you've got two answers that are similar, how to differentiate, how to, maximize your marks. We're definitely going to be delivering that on the 3rd of September. We've already got quite a few signups, and if any of you guys are interested that are on this webinar now, you can go through to our website and book on. And if you use the code earlybird20, you'll get 20% off. I think Mark, you were one of the delegates on the last one, if I remember.
It's a very good course. I can vouch for it.
Yeah, so Mark was one of our delegates last time. We were going through, and it's updated for 2022 as well, giving you a lot of that insight that you definitely need, and to give you that confidence boost. If you're just feeling that, you're wanting that just before the exam, some teaching. So that's definitely something we'll deliver from there. All right. So if we go on to the next, swiftly on to the next section. So these are the OSCE examinations. And we're all familiar with this information that I've got. Just a reminder, 14 live stations and 2 rest stations dispersed. This is obviously held in person. I don't think it's feasible to do this online. It's held in Liverpool. Stations are around 8 minutes with a timer warning given off at the 7-minute mark to allow you to complete with 1 minute. There are 2 minutes outside each station to read instructions, make so many preparatory notes, and they're examined via a checklist with 35 marks available for each station with a maximum mark of 490. You must pass a minimum of 9 stations out of the 14 that are assessed. If you pass 8 and you're very close on the 9th, they will not allow that. That, in terms of, can you please, and they're very, very strict in terms of that. You will have to pass the minimum of 9. And on top of that, there's an aggregate score, which I would explain in simple terms. You would have to pass all the 9 stations in with good marks. If you're barely passing the 9 stations, it might not give you an overall total aggregate score that gives you above the threshold. So it might be that this year there's 9 out of 14 you must pass, and the aggregate score is 320, 340, something like that. That will give you an overall passing mark. So you must get past the 2 sections. You must pass 9, and you must pass with an aggregate score which is higher than their threshold as well. Now, the OSCE exam is generally the tougher of the two, and people generally do tend to, because it's nerve-wracking situation. You're in person. You're generally not with people that your classmates that you generally normally have exams with. It's not your normal examiners either, your normal lecturers. Some people tend to, struggle with their nerves, with performing at their best in these kind of situations. So we thought we'd also talk about this a little bit. Obviously, we're mindful of FPA guidelines. We're not going to give exact stations that have come up in the past, but a general feel we can give, of what kind of tough stations, what kind of things they expect. Is it multifaceted? Is it just one thing at a station only? And then we're definitely going to do that as well. Okay, so let's talk about the next little bit. So they're basically broadly separate into 4 sections: communication skills, examination skills, procedural skills, and emergency management. Now, as you can see, communication skills forms the basis of this. It's a big chunk. So whether that's a simple history taking, whether that's a breaking bad news, whether that's, a psych history, whether that's, calming down an angry relative, whether that's communicating with a parent about a sick child, these are all sort of communication skills that they definitely want you scoring high marks in. These are the stations, guys, that you can absolutely smash and get their high marks and boost up your aggregate score. And it's something that, everyone that's going into the national OSCEs should be very well versed in. It could also be explanation stations. For example, a patient has come in wanting an explanation on anemia, wanting an explanation on a colonoscopy, for example, and they want you having that high level of knowledge to be able to explain these things in layman's terms, but also a rounded knowledge, whether you know about anesthesia, you know about post-procedure care, and you're comfortable explaining these things. Okay. There's also 30%. Like, these are not solid in stone. They can be a little bit up and down, but generally the next most commonly examined area is examination skills. So we're familiar with these, whether that's, respiratory exam, knee exam, MSK, big station, cranial nerves, that kind of thing. Now, these kind of examinations, an often added benefit, if you can call it that, from the nationals is they will often ask you to interpret your findings. So they will give you patients, the skilled actors, with signs. So it might be a patient that has a finger clubbing and you're expected to pick up on that, with breath sounds that you're expected to pick up on, whether they've got COPD, emphysema, long-standing, anything like that. So a patient that's got heart murmur, I know that's previously been brought up in the past, whether a patient does have a heart murmur and you're expected to pick that up. 20% are procedural skills. For example, your simple things, cannulas, venipuncture, performing an ECG, that kind of thing. And you're expected to perform that really fluidly, really slick, and keep it on top of that at all times, and also then interpreting. So they might tell you to do venipuncture and say, this is the FBC result, come back. What do you think? All right, that's a clear anemia. This is my next steps. I'm going to take some hematinics. I want to get the folate, the B12, the iron level, etc., etc. Things like that. ECG, okay, you performed it. What do you think? Interpret this. What's the diagnosis from this ECG? You're expected to be on top of that as well. And the last one is emergency management. This is your, A2E assessment that we're all taught to do, managing emergency situations, whether that's an asthma, severe asthma attack, anaphylaxis, something like that. You're expected to manage that, and also put into procedure. So examine the patient, also manage, as you think, might be a hypoglycemia, anything like that. They can throw up in the emergency. So this is a station or two in the OSCEs that often people fall down on, just because of the high stakes. The patient is sick. Often it's a sim man, not a real patient, and that can throw people as well. So that's something that you should be aware of. All right. So again, sort of similar. So if you can give us sort of an overview, AXA, of these kind of questions, then we'll go to Mark. Obviously, it's been a little while since you've done but I'm sure you can provide good insight, and I will as well. And then we can go to specific questions from the floor as well. So if you start, AXA, with how difficult the exam was compared to uni, etc.
So I'd say with uni, OSCEs, we were just kind of taught, or take a history and give us your differentials. Whereas in the actual the pain, there was a lot more to do. So it might be take a brief history, perform the, I don't know, let's say an ear exam, for example, and then give us present your findings and differentials. So I feel like in the nationals, there was a lot more that they asked you to do. So once again, time management is an issue. That's what I found more difficult. I also felt that in terms of the actual content and what they were testing is not hard. It's just about being able to do everything that they're asking you to do, because that's where you get the marks essentially. Apart from that, I think the main thing is to be confident, because that really shows, and first impressions really count. So then first kind of, that minute where you're introducing yourself to the patient, I think it's really important, noting down what their name is. It's small things like that, but they play a huge role in that kind of, in how you come across. So yeah. In terms of revision tools, it's all about practice with OSCEs, and examiners can clearly see that when you have practiced enough, and the way you speak to patients.
Yeah, I'll just add on that, AXA. Examiners can definitely see which students have actually put hands on. So whether you're doing an abdominal exam, don't just sort of think it and revise independently. It's very, very key and good idea to revise in groups for OSCEs. You can perform on each other, give each other tips, and okay, I would have done it slightly like this. Why have we done it like this? And when you're palpating my tummy, abdomen, you're not going, having that deep palpation. You're not able to feel the liver. You can palpate a little deeper. It's very, very obvious to examiners, which students have put hands on patients, whether that's an MSK exam. Have you felt the weight of a leg in your hands and been able to move it through all the planes of motion that a knee joint can go through? Have you done that in real life? Examiners can definitely tell that, and this is something that you need to be doing in groups, or doing it actually physically in person, rather than just solely relying on videos and theory practice, I think. What about Mark? I know it's been a little while since you but if you can think back, what kind of tools and tricks and tips for our students here?
So yeah, whilst it was a while ago that I did the national exam OSCE, I have been OSCE examiner at UCLAN, Liverpool and Manchester multiple times in clinical skills and OSCE revision sessions, as well as end of uni exams. Preston in particular, they were heavily involved with the national, and they would take things from the national exam and try and put them into their practice. And for example, they wouldn't necessarily ask you to do a full cranial nerve exam, and so they would. One of the things that throws students off is they learn how to do cranial nerves 2 to 12, but then if they take out cranial nerve 8, it throws out all of your kind of examination. So, you know, some of the common things to not do, like 2, 3, 4, and 6 is really common to do. Snellen chart and the visual acuity is a common thing to do. You wouldn't necessarily be asked to do the whole thing, so that's something that might trip you up. Get good at sort of picking out the common nerves that are put together, for example. Our OSCE prep in Birmingham was very close to what was in the national. There would be focus history and examination in some of the stations. Some of them would just be communication stations, and that was similar to what we did in the national. Absolutely make sure that you know how to do your cardio, respiratory, and GI examinations, because one of them will come up in one way or another. They're the big three, and they will be guaranteed to come up. You know, it's almost a certain thing. In one way or another, whether it's a partial examination or not. I would be very, very surprised if they didn't come up. In terms of preparation for it, I think I did around about 200 stations in preparation from an OSCE textbook, and we just worked through them. There was 3 of us. One would practice, the other one would give feedback, the other one was the patient that gave feedback, and obviously you rate your own performance, as well as having feedback from that third person who's making notes and saying, oh, you could have done this, or you missed this, or whatever. I 100% agree with AXA. The confidence that you have and looking like you've done this plenty of times before goes a mile, because there is, as far as I know, a mark at the end of how did you overall feel this student performed, and what's the overall feel of, yeah, they were confident, they knew what they were doing, they knew how to do each bit of the examination and do it well. And, you know, there are very easy marks picked up for introducing yourself properly, having a good, building just a very slight good rapport with the patient, having a smile on your face, just being welcoming and having a good bedside manner. In terms of the national, and I know a lot of people ask about how much do I talk through what I'm doing. Certainly when I've done OSCEs for the Northwest universities, they're not necessarily interested in, I'm looking for this because of this. It's just, I'm looking at the or car staining and finger clubbing, the Shamroth sign. You say what you're looking for. Another common thing is if you're feeling for the pulse, rather than saying I 30 seconds or 60 seconds, at least do it for 30 seconds and count it and say the heart rate is a good character, and like actually relay finding the chest is clear, perhaps there's no wheeze, for example. You can summarize it as you can summarize it at the end. I tended to find put your patient as a patient and say, during this examination, I'm going to explain what I'm doing to the examiner. Is not an unreasonable thing to do. As I would do if I was teaching someone to do a lumbar puncture, for example. I would say, like in clinical practice, I would say to them, I'm going to be explaining things, don't be alarmed. I'm going to be talking through some things. I'll address you properly if I'm talking to you. Otherwise, don't worry about anything else that's being said.
Yes, some really good tips there. Yeah.
You know, they'll be ticking off things. You know, if it says, you know, look at the hands, you might get a mark for getting 3, and you might get 2 marks for getting 5. So it is good to say exactly what you're looking for so that they can tick off, okay, yeah, you found these things and they're relevant to this examination.
Thank you very much, Mark and AXA. I think that's really, really useful, definitely for our students in terms of what the exam sort of entails, what are good tips, you know, coming up to that exam and making sure that, you know, you're one of the high scoring students. You know, I think we mentioned the top 3 questions in some degree. So in terms of AXA, the last real question is, you know, again, tips on the day. So, you know, obviously this involves some travel to Liverpool. Can you just mention a little bit about that? Do you recommend getting a hotel, public transport, you know, going in a group, you know, if your friend has one in the afternoon, go together, or does that make you more nervous? I mean, once you're in there, in the centre, what happens? Can you tell me a little bit more about that, please?
Yeah, sure. So I'd say if your exam is in the morning, definitely don't rush on the day, don't travel because anything can happen. So book a hotel room, whatever. Even for the afternoon, really, I'd say it's probably best just to calm your nerves, because it is really important that you get a good night's sleep. You don't want it to affect your performance on the day. In terms of when you get to the venue, so the actual Royal College of Physicians building, they're really friendly. Like they try to make you as comfortable as possible. You'll have water there as well. There'll be other people, so you're in a holding room where you'll be sat before you go and do your exam. But it's a nice kind of chance to speak to other student peers, just to calm your nerves. And then when you're actually when you go for your exam, you have 2 rest stations, and then there's water available at every station as well. So if you're getting kind of nervous, one thing that I would recommend is don't think about once you've done the station, don't carry on thinking about it because it will affect your performance in the next one. So once it's done, it's done. Just let it go through your mind and just focus on the next one. But apart from that, yeah, it is important that you stay calm, confident, and anything that you do get on the day, just remember that you have come across it. It won't be anything new, and you can do it. So yeah.
I think that's really good tips from AXA there. I would sort of agree with that. In terms of going to Liverpool, sometimes some of you may have never gone to Liverpool before. Make sure it's all planned out. There's from that side of things, from travel and this kind of practicality, it should not be an issue. Your main focus on that day should be your exam, and any other stresses should not be eliminated as much as you can. So whether that's getting into a cheap hotel the day before or expensive one if you're that way inclined, making sure you have that rest, you're ready, you're happy, and you're raring to go on the day of your examination. And I agree, the FPA building is within the Royal College, and it's very beautiful actually. Once you're quite modern, and once you go in there, they hold in a holding room, and you can sort of do any last minute preps. And then once they say, okay, it's time to time for you to go on, everything's put away, and then you're lined up in your group, and it might be with people that you've never met before. That's okay. It'll definitely be examiners most often that you've never met before, simulated patients that you've never met before. But just remember, what you do know is the content. You've been through the examinations, you've been through the history takings, these last 2 years placements, everything that you've done so far has prepped you for this OSCE examination. And I would definitely agree as well, if one station perhaps is not your best station, or if you start with one that you felt a bit unsure about, or it's often the case where it's a procedure station, for example, in venipuncture, something like that, and you're just not able, your hands are shaking, or because it's your first station or whatever, you're not able to get the blood flow. And I would say don't worry about that. Take that into your next station. Do the best you can. Focus on your fundamentals. For example, sharps, keeping sterile. These kind of things that you would definitely always do. Stick to that pro forma. Don't let one little bad section, disrupt the next things. So if you can't get the blood flow, say, I would obviously clean and start again. I would apologize to the patient, clean again. Or if, for example, is a explanation station and you're not familiar with the one aspect of it, just explain to the patient, I'm sorry, I'm unable to answer that specific query right at this second. I will definitely get you more information. Once, is there any other questions that you may have, and just align the patient, get them back on side. You're not expected to know everything at your level, and that's why with the OSCE, you need to pass 9 out of 14. There's a reason they're not asking for 14 out of 14, because they understand your students is a continual progress. And once you qualify, you'll get obviously better and better. These are the kind of things that would definitely give us top tips from myself, having started a few years ago, for anyone going forward. So I think a couple of questions, and then we can go to the last little bit. Mohammed,
Yep.
anyone?
There are. Yeah, I'll start off with questions in the very helpful Q&A section. So Momina Iqbal has asked, does the examiner in your station ever stop you and ask for any summaries or differentials, or stop you to ask any questions? Looks like someone's mic is on.
Yeah, so I think, like I was saying earlier, they have that 1 minute break. So you have 8 minutes within the station, 2 minutes outside, and that's minute 7. If they're feeling that you're not sort of coming to the natural end, or they have a few questions that are enabling you to get a few extra marks. For example, there might be a few marks on a knee examination, for example, for a potential differential and first line management. So they might ask you, what do you think it is? Or then you can say, potentially my first differential is, osteoarthritis, muscular injury, this kind of stuff. They will sometimes stop you. Don't think that in a bad way, don't think it's just to help focus you a little bit. It's most likely right at the end of the situation, or if you're going off topic. Say, for example, the examination station, and they've said, can you please examine the respiratory system of this patient? And they said, don't examine the hands, and you start with the hands. They will most likely stop you if they're kind enough, because that's going to waste your time. There's no marks available for that. So how Mark was saying earlier, cranial nerves can sometimes be a bit tricky in terms of they'll give you specific instructions, examine these. So read the instructions well. So the examiner will stop you in 2 situations, whether you're going totally off topic or whether they want to bring you back into focus, you're going over the time. And thirdly, if there are any extra marks available and they want to focus your direction towards that. Next question.
So next question is from the floor. Shraddha has asked the question. Got her hand up.
Hi, can you hear me?
Loud and clear.
Oh, hi. So I just wanted to ask, will there be, under special circumstances, an additional time given to the person?
Under what circumstance?
So, say if you have like say dyslexia or any other medical condition which you think is special circumstances, would you be given an extra time during SBA or OSCE?
Yes, I'm pretty sure that's a stipulation. You should. I'm sure you have to raise this when you initially book. So I don't know what stage you're at the minute, but definitely need to. If you haven't done so already, you need to do that ASAP. I'm not sure quite the protocols, but definitely I'm aware they have some allowances for students in your, for example, if for needing extra time. If you've needed extra time for examinations in the past, if it's recognized, and you've got some reason for that, then definitely they do allow extra time. But you need to be clear on that once you're booking, and making sure they're aware. They wouldn't just pick up on that if you haven't made them aware. Okay.
Okay, thank you.
Another question from the floor. So Kirsty Hardy, all yours. Oh, it looks like your hand's been withdrawn. No problems. We'll go for Rimsha Ahmed.
Hello, can you hear me?
Loud and clear.
Oh, great. So I'm just wondering, because I know that at the end of the examination, well, certain physical examinations, you're asked to, the examiner may say, okay, so, what is your differential diagnosis? And I understand you're supposed to suggest a sensible, likely diagnosis, a differential diagnosis, but say your differentials are wrong. Would you probably not get the mark if you don't suggest the right differentials? That might be a bit of a silly question.
As far as I'm aware, they're not going to totally discount your station if you've done the rest of the procedure right. If, for example, say a certain situation, if you go to the knee exam again, and it was septic arthritis, for example, the actual diagnosis, and you've perhaps said, a cellulitis, anything like that, maybe they would question you. Why have you thought about that? And then you have to give some sort of reasoning. And if your reasoning is sound, the patient is, febrile, patient has pain, patient has swelling, potentially you could think, and then they would probe you a little bit. Is there anything else that you'd potentially consider? Now, this is giving you a chance to think about some of the things. So if you get the differential totally wrong, I mean, they wouldn't totally go against you. You obviously wouldn't get a mark for if there was a mark available. But if you're totally off track, then potentially that would negatively affect you. And at this stage, the examiner would ask you questions about what's your thought process. So don't just pick out something random. If, for example, you're doing a respiratory examination, and you've done the whole thing and you just blurt out asthma, whether it's got nothing to do with asthma, it doesn't sound like asthma, they're going to really question you and consider, have you, when you've been examining, have you just been acting out like an actor, or have you actually been clinically examining a patient? Does that make sense? So no, oftentimes in these nervous situations, it can be quite common just to blurt out the first thing that comes in your mind. But really consider, I've examined this patient. What are my differentials? What am I thinking of? Based on this history, this age demographic, what are the clues the blurb outside gave me? What kind of things am I going to be thinking about for this patient in particular? And then consider it from there. Sometimes that can happen under nerves, but really consider. And the examiner will sometimes ask you, why have you said that? And as long as you can justify, you'll get some of the marks available, even if you don't get the top differential. That probably is right. I hope that answers the question.
Yeah, no, it does. So would they ask you specifically to say give your diagnosis, or would it be more like give your differential diagnosis?
They will always say differential. It's very difficult for any clinician to make 100% diagnose, clinically, with everything. I mean, I work in secondary care and we definitely rely a lot on bloods, x-rays, etc. But I know some of my GP colleagues can definitely examine just on clinically, give a diagnosis. So you can say, this is my differential diagnosis. I would like to do some further tests to make sure. So I'd like to do blood tests, for example, imaging, that kind of thing, ultrasound, whether that's a CT scan, X-ray, that kind of thing, and that would give the examiner more theory that yes, this physician associate understands, that it needs a bit more information to get the diagnosis for this patient. Okay.
Oh, thank you so much.
Brilliant. Quick question from the Q&A. I'm not sure if this has been covered. I might have missed it, but it's just quite a specific question. Do you know how long do you get before at station in order to read the instructions?
It's 2 minutes.
2 minutes.
2 minutes.
Unless you have extra time, like we were mentioning earlier, but it's definitely 2 minutes.
2 minutes.
Brilliant. It's enough time to read. It's normally not quite long. It's normally quite short. It's enough time to read it, to definitely digest it and make a few notes. And at this stage, I'll definitely make some key notes. What they're asking me to do, note the name and age of the person as well. That's something that's key as well. It'll give you good rapport if you can say hello. Can I just confirm? Oh yes, I'm expecting to see yourself. That kind of thing. So you definitely know what you expect from the thing. Also, sometimes there's some can try to throw you out in terms of the form outside gives you a different name, and once you go in, for example, if it's a sim man or something, and you check the wristband, and it's a different name, or you're doing venipuncture and check the name and it's a different name, these kind of stations have previously historically been somewhat considered as well. So that's something that you definitely need to make a note of if you're going for the right patient as well. So 2 minutes, enough time to read it, digest it, make a bit of a start. What kind of things am I questioning? Have I got the red flags covered for a headache, for example? I'm going to ask about thunderclap, I'm going to ask about pain severity, I'm going to ask about vomiting, this kind of stuff, So 2 minutes.
Awesome, brilliant. So there are a fair few requests for questions, but I'll just select a few of them from the floor to begin with. Anisa, if you could quickly ask your question, and then we can give a response.
Hi, can you hear me?
Yeah.
So I just wanted to ask, if you're given a date for the OSCE and say you can't attend, are you able to reschedule it for one of the other dates?
I think that's a tough ask. You'll have to email them, and I can't give you a yes or no answer. I think it's tough. I don't think it's an easy thing to do. But you have to go with them. It's not a case where you can just simply swap with your friend. I don't think it works like that. You'd have to email them and tell them your specific, extenuating circumstances why you can't make it, and they would be able to facilitate you maybe. But say for example you're one of the last dates, how they, it's very, very difficult. It's a big organizational, logistical nightmare, I suppose, in terms of getting so many students through. So I can't promise that at all. Okay.
Yeah, that's fine. Thank you.
Awesome. So we move on to Kirsty.
Hi, can you hear me?
Yeah.
You can hear me?
We can. Yeah.
Oh, no, sorry, I've been having problems with my microphone. Just some confirmation, I think Mark's probably the best person to ask regarding talking to the examiner, because at Newcastle Uni, we've kind of always been told not to do that, and that the examiner should see what we're doing and, make it obvious what we're doing. So we've it's ingrained in us not to do that. The same caveat of that question is, when it comes to procedures, are we going to have a plastic arm, for example, and have to speak to the arm as if it was a patient? So it's just, is there any negative marking in over talking to the examiner? I think in my head, I would go into the OSCE as if it was a real patient and the examiner is just in the corner and he's not meant to be there. But then the way that it's been described, it seems that it is an examination situation where the examiner is part of the the overall, setup. So if we could just have some confirmation about, would we be at a detriment if we went in and didn't acknowledge the examiner? Because that's how I would approach the situation.
I guess the difficult thing is, from an examiner point of view, is they have to be able to see what you're doing to be able to give you the marks. For example, I remember doing a diabetic foot OSCE, and the curtain was sort of in the way, so they didn't look at the bottom of the foot and they didn't see that there was kind of an ulcer that had been drawn on. They said, I'm looking at the bottom of the feet, but they didn't look and actually see it. So there's kind of two things. You have to do both, I would say. You don't get the mark for looking because you might miss the diagnosis. You do have to look and examine properly. I have heard this thing where, completely ignore the examiner, but how would an examiner know if you're looking for finger clubbing is fairly obvious, but if you're looking for tar stain and what the pulse actually is, you can summarize it at the end, but I just feel that's a much less efficient way. If that's the way that you're used to doing it, when you do like your S-bar at the end, by all means, you can summarize it that way. But we were taught to speak to the examiner throughout, and you wouldn't be negatively marked by that, so long as you explain to your patient what you're going to be doing. It's something that
that's really good to know. No, that's good to know, because I think that makes a lot more sense, especially at the end, if you do forget something that you did look for, but you forgot to say it out loud, you could miss a mark doing that. So no, that's great. Thank you very much for clarifying.
I would agree with Mark there. I would agree with Mark.
Yeah, I've never been an examiner in the national, but certainly that's how we did it at Birmingham. That's what I remember doing in the national, and that's what I've done. That's what I've encouraged students to do when I've done clinical skills sessions and things.
Yeah, me too.
Brilliant.
Sorry, just to follow on, Matt, when you did your recertification, you didn't do OSCEs for that, is that right? It's just the SBA. Sorry, who's the other one? Is it ASQA? Did you approach AXA? Sorry, did you approach the OSCE by walking in and acknowledging the examiner and then state, I may speak to the examiner and talk through what you did in the examination?
So what happens, Kirsty, is you have a name badge that when you walk in, you have to show the examiner your name badge, just so they can confirm that they're marking the right person. And then you just kind of ignore the examiner. There will be a patient in the room. You introduce yourself and you just go on as normal. So if you're examining the patient, what I did was I was just saying what I'm doing, and I'd say like if there was negative or positive findings, because rather than leaving it at the end, I just think it's just a lot of pressure at the end. You're most likely going to forget it. So just say what you're doing, make it obvious, like just you taking a glance at the hands. How do they know what you're looking for if you're assessing for nicotine tar staining or whatever? So I'd say make it obvious what you're doing. It'll just makes the examiner more aware
of what you're doing, because they can't read what's going on in your mind. So, but I know what you mean. Like you don't really need to interact with the examiner. Don't ask the examiner anything, but you won't be negatively mad. They'll probably just politely say, just read the instructions, or they'll kind of redirect you, but they won't answer your question because they're not allowed to. Does that make sense?
Yeah, no, that's perfect. Thank you very much.
You're welcome.
No problems. Brilliant. So we're going to quickly go through some of the other questions. If I can just request that you keep your questions quite concise, and then subsequently it just allows us a little bit more time to answer them. So Shireen?
Mine was just in regards to the uni OSCEs mirroring the nationals. So in our uni OSCEs and across other unis, procedural skills got taken out. So I was just wondering if there's definitely going to be procedural skills in the upcoming national OSCEs.
Yes, there will be. It's all back to normal now.
Yeah, it's still on its website. I've checked the latest guidelines. They're still on there. So I would be preparing as if they're going to be coming up, because you don't want to be in a situation where ABG, cannula, venipuncture is going to be mainly one of them, but you definitely need to be prepared for their ECGs, that kind of thing. You definitely need to be prepared for that. So consider they.
Sorry to butt in, Camille, but just to add another thing, we were kind of advised that MSK stations wouldn't be coming up because you can't perform an MSK exam on a mannequin. But now there's real patients, so just be prepared for anything and everything to come your way. Anything that's on the blueprint can come up.
Yeah, just on light of that, be aware. It might be like a physical examination, an intimate examination, breast exam, rectal all these kind of things can come up. So just be preparing for everything. Yeah.
So in terms of the histories and stuff as well, it's not going to be on a screen anymore. It's going to be with real patients.
It could possibly still be on a screen, but it will be a real patient. You won't, even if the patient needs to be there through the screen, it could possibly be, because you can still do history taking like that. But I think they're changing it to where the patient's physically in the room.
Yeah, I've got a strong indication as well. It's going to be a person in the room. Don't be thrown off if it's, like I say, if it's you're speaking through like a laptop with a patient, or for example, if it's a sim man, like a plastic model, mannequin. These kind of things can be anything or anything. Unfortunately, COVID's thrown a lot of this, thing in disarray. But this bringing everything back this year, that's what the official guidelines are. So expect real patients to be there, simulate patients to be there.
Thank you so much.
No problems. Juliet Anuha?
Hiya. I just kind of wanted to ask, in our OSCEs, we are told to obviously kind of as a habit ask for a chaperone. Now, I kind of go, oh, okay, for the purpose of this examination, I would request a chaperone. But would you, in that case, want to say that the examiner would be your chaperone, or would you want to say, I would request a chaperone and just continue?
Yeah, just request it and continue, because you've made the point, you'll get the mark. You don't need to waste any more time kind of, with anything else really.
Right, okay, so you don't refer to the examiner as your chaperone?
No.
You can do, well, I mean, you can say the chaperone, the examiner is going to act as a chaperone. As soon as you say the word chaperone, you've acknowledged that you've got the tick. You don't waste any more time on it.
Brilliant, thank you.
Brilliant. And we did have Callum that wanted to ask a question. I know he wasn't able to ask the question last time. I'm not sure if he still has a question.
Hi, okay. Sorry, this was with regards to the SBA exam. How much are we expected to know the 2A and 2B conditions on the matrix?
So I was actually following the 1A, 1B, 2A, 2B classification. When I got to the exam, I realized, you know what, I don't think they really are following it. So my advice to you would be just learn everything, unfortunately. Yeah.
Thank you.
The exam, I would be honest, the exam is more heavily weighted towards like the bigger conditions, and they're normally covered in 1A, 1B. So don't put too much emphasis, but big conditions are normally covered a lot. Asthma is covered a lot. Things that you'd expect, heart failure, pancreatitis, things that would come up, things that are common are more likely to come up more often. I would think of it more like that in terms of 1A, 1B, these kind of things. But if you were to say as a general rule, 1A and 1B conditions come up a lot more in the examination. But in terms of specifics, in terms of diagnosis, management, that kind of thing, no, if it's a 2B question, it can be asking on diagnosis, it can be asking on management, that kind of thing. All right.
And finally, for this section, Kate Brooks.
Goodness, mine's an SBA one too, but I do have to run away. Sorry. It was just about when we do like we have to, do we show our room to them on the camera? Like if I need the toilet, do I have to take them and show my toilet before I go?
You better have cleaned it.
Oh, we got it. Yeah, right. I just was wondering. Yeah, I'll make sure there's no skid marks or anything. But please, could you explain if I have to show my room before, after, or how it works? Oh God, I got you cracking up.
You don't have to show your toilet. I know that much.
Fab.
I can't remember exactly what the process is. It's not very complicated. It's not something you should worry yourself about. You might have to show your room, and you just be as quick as you.
Okay, fab. But no like house tour.
But you just you're in.
Just the room we're doing the exam in. Fabulous.
Yeah.
And then our piece of paper if we've jotted notes as well. We'll do that at the end, do you?
Yeah.
Thank you, Mark.
Yeah, to be honest, Kate, I wouldn't worry too much. I think there's a set procedure. This company that runs this exam has a lot of other examinations that they've run before. There's clear guidelines in terms of, going to the toilet. Obviously, it's a human thing. So I wouldn't recommend, sitting on a commode or anything like that. Just mark it up.
Wearing
You're going to the
nappies.
toilet, you're going.
Okay, fab. Thank you so much, guys.
No problems at all. Brilliant.
I think that's I think we're going to wrap it up. So I think that'll be the last question of the day. Thank you all much for joining us. I'd just like to show you a brief video and then I'll explain about our summer masterclass as well.